Okay, hi everyone. Okay, my name is Dr. Zuriati, and together with me, Puas Yuwon. Today we're going to discuss one of the research that we have conducted, which is the perception of family, emotional experiences, and social influences of orphan adolescents in Malaysia. What is orphan? Orphan are children who lost one or both of their parents to death. The number of orphans increased tremendously by 154 on 20 September 2021 as reported by the Star. Often adolescents' perception of family was interested to study as it may be influenced by the environment they lived in and also whomever they were attached to. Lack of family life experiences has negatively impacted the development of child, especially in their emotional domain. Past study reported that orphans were exposed to more stresses, including death of parents, life challenges or life changes, loss of love, and also social support. Social support seems to help orphan adolescents to cope with struggles faced in an orphanage.
Moving on to the problem statement, orphan adolescents' interpretations on family varies due to the absence of parental figure. Orphan adolescents who grow up without family are vulnerable to emotional distress and prone to experience loneliness, entrapment, and low self-esteem based on the past studies. And the minimal information was found in previous study, which was not sufficient for researchers to develop suitable and effective intervention programs. The lack of empirical research in understanding the way orphan adolescents define family and how does the absence of family figure relate to their emotions, along with the role of social support, have brought the researcher to this study.
To achieve the objective of this research, we came up with 3 research questions and 3 research objectives, which is the first one was to explore the perception of family among orphan adolescents in Malaysia. The second one was to discover the emotional experiences of orphan adolescents in Malaysia. Lastly, to understand the influence of social support on orphan adolescents in Malaysia.
For the literature review, we basically uses Bernstein-Brenner's theory for this study, and we focus on the interaction between child and their close environment. We also focus on how the child interacts at a larger environment. The orphan adolescents refer other figures as family as they get attached to them when the parental figure was absent. Individuals with insecure attachment style or lack of parental care were associated with internalizing problem, for example, depression and anxiety throughout their adolescenthood as well. The high duration of stay in orphanage and low levels of social support may increase the prevalence for orphans to develop depression. And the findings reveal that family relationship and perceived social support, particularly from parents or caregiver and teachers, are correlated with positive psychological outcomes for children based on the past studies.
To achieve the objective and also the aim of this research, we have conducted a qualitative approach using phenomenological design on 8 participants. The participants was recruited to this study based on purposive sampling and also they involved in one-to-one interview. All these participants are from orphanage in Klang Valley, Malaysia. The participants age range from 13 to 17 years old, and this study involves 6 males and 2 females. Out of these 8 participants, 4 of them are Chinese, 3 of them are Indian, and 1 of them is orang asli. The interview questions was divided into 3 sections, such as the section A, the questions was developed to discover about the family. Section B is more on emotional experiences. Section C is more on social support. The questions are from past studies as well. So for example, for section A, we asked about how do you define family and is there someone else that you can rely on or refer as family. The section B, the questions are related to emotional experience experiences, also from the past study. At the same time, we also added a few of the interview questions as well based on our research question and literature review. The questions mainly ask about how do you feel as you grow up in an orphanage? What are the struggles you experience living in an orphanage? Lastly, the section C is about social support, where we use the social support skill for children, but we change it to qualitative method. So the questions was about how often do you receive social support from the society and what are the expectations on future social support. We use the thematic analysis to analyze the data, and we found out there were 6 themes that we can generate from the transcriptions. All right, so these 6 themes are for all these 3 research questions. As we can see on the screen, the research question 1 has 2, research question 2 has 2, lastly research question 3 has 2 themes. So altogether 6 themes. So the next slide is about the quotation from the past study. So so perception of family, emotional experiences, social support. So we have only reported for this conference purpose, we only reported the main quotation from the participants.
Moving on to the results and discussions. So basically, orphan adolescents view caretaker as their family figure in our study, and they also refer family as love, care, and harmony. Orphan adolescents reported happy and satisfied while living in the orphanage. For our study, which was contradicted to the findings of past studies. This is because in the past studies, they mentioned that orphan adolescents are usually depressed and they face a lot of self-esteem issues as well. But in this study, it was not the case. Orphan adolescents receive informational support, peer support, tangible support, and educational support, which were effective in maintaining the well-being of them. The participants had also expectations in receiving informational support like work training, social network support, and tangible support for the future. Orphan adolescents also require social assistance to live a better life, as supported by past studies as well. In conclusion, this study stressed the needs for family and friends for orphan adolescents in who they can confide with. The existence of social support was crucial for orphan adolescents in the hope for them to manage their emotions better. It was also effective in helping them to integrate well into society. For some implication, future researchers may utilize other methodologies and future researchers may also involve the caretaker in the study to understand from their perspective and what they do to help orphans to live a better life. Here are the references and thank you.
Okay, thank you.